Welcome to our channel dedicated to providing information about anesthesiology and intensive care. Today, we will be discussing anesthetic management for patients with a history of pulmonary disease. Patients with a history of pulmonary disease, such as chronic obstructive pulmonary disease, COPD, or asthma, can face challenges during anesthesia. Anesthesia can have a significant impact on the respiratory system, so it's important to take extra precautions for patients with a history of pulmonary disease. Before the surgery, the anesthesiologist will conduct a thorough evaluation of the patient's respiratory function. This includes a review of the patient's medical history, pulmonary function tests, and other diagnostic tests. The anesthesiologist will also assess the patient's oxygen saturation levels and lung function to determine the best approach to anesthesia. Depending on the patient's specific condition and the type of surgery, the anesthesiologist may choose to use general anesthesia or regional anesthesia. In some cases, the anesthesiologist may opt for monitored anesthesia care, MAC, where the patient is sedated but remains conscious during the procedure. Patients with pulmonary disease may be prescribed medications before the surgery to help them breathe better. These medications may include bronchodilators, steroids, or antibiotics to prevent infections. It's important for the patient to continue taking these medications as prescribed by their doctor. During the surgery, the anesthesiologist will closely monitor the patient's oxygen saturation levels, heart rate, and blood pressure. They may also use a combination of medications to ensure the patient's airway remains open and their breathing remains regular. After the surgery, the patient will be closely monitored in the recovery room to ensure their breathing is stable. The anesthesiologist may prescribe supplemental oxygen or medications to help the patient breathe more comfortably. It's important for the patient to continue taking any prescribed medications as instructed and to follow any other post-operative instructions. We hope that this video has helped you understand the anesthetic management for patients with a history of pulmonary disease. If you have any questions, please feel free to leave a comment below, and we'll do our best to answer them. Don't forget to like and subscribe to our channel for more informative content about anesthesiology and intensive care. Thanks for watching.